Hi everybody, welcome to ECTC's Allied Health Showcase. My name is Mattie and we've got Emmy off camera who is working all the technical side of things for us, and she's monitoring the comments. Speaking of comments, make sure you go ahead and comment where you're watching from, maybe the programs that you're interested in talking about today, or anything that you want to let us know. Maybe you've got some questions that you want us to answer before the end of our time. Just so that you know, to be able to comment, you're probably going to have to be logged into a Gmail account. We went ahead and put that information in the comments as well. So let us know where you're watching from and who you are. We are so excited to be talking about our allied health programs today. As a second disclaimer, some of the video footage, that you're going to see today was actually filmed prior to the COVID-19 pandemic. So if they don't have masks or something like that, it's because it was filmed pre-COVID. Here at ECTC, we are following all of our Healthy at ECTC guidelines to make sure that campus is safe for everybody. So let's go ahead and get started into it. If you didn't know, we have 4 allied health programs that are selective admission, meaning that they have a separate admission process from ECTC's general admission. Those selective admission requirements often include an application, completion of prerequisite courses, and attendance of pre-admission conferences. Each program's admission requirements are a little bit different, but generally speaking, most students with a high likelihood of acceptance into these programs are students that are driven to study and succeed. They show a particular interest in the biological sciences. They're passing those prerequisite courses, and they're students who have met benchmark in math and reading on their ACT or other exams. If you requested the link to this video, or this live session rather, prior to us going live, then you also received a fact sheet that has everything laid out for each program that is selective admission about what they require. If you're catching us on the replay, no worries. All of that information for the selective admission processes for each program will be on their program pages. That is on our website. You can get there 2 different ways. You can go to our website, from the homepage, navigate to the Education and Training tab, and then find that specific program and locate that selective admission program information there. Or you can take advantage of what Emmy did for us, and she went ahead and put all the URLs, those links to those program pages right here in this video description. So be sure to check those out for all of that specific information. You're also going to hear some of that from our instructors. But enough of me talking. Let's go ahead and get into our first program, Diagnostic Medical Sonography. This is our newest allied health program and now has graduates in the program that are out in the workforce. We had an awesome time sitting down with these students, learning about the different types of images that they capture with the sonography equipment. And you may be interested to know that it's not just working with moms and babies. So let's go ahead and take a look.
Our program is a general sonography program, which means students will learn abdominal and OBGYN sonography while in the program. It's 3 semesters in length, and students pretty much start scanning on the 3 machines that we have here in the lab on day 1. So it's a lot of lecture up front in the first semester, and then after about 8 weeks, most of the program is clinical. We have several clinical affiliates throughout the area, and we send 1 student to each clinical site, and they get to work one-on-one with the sonographers, and those sonographers will work with those students in their scanning skills and help them to master that skill. And they go 3 days a week, pretty much 8 hours a day. It's pretty much like a job for our students. I think sonography looks very easy when you're watching somebody do an ultrasound. You know, we're scanning a patient, we're pushing some buttons on a machine, and that's it. That's not all it is. You know, you have to be able to identify anatomy. You have to be able to adjust the ultrasound machine to get diagnostic quality images. And it's not just pregnant mothers that, you know, sonography is useful for. It's useful for diagnosing cancers on the kidney, you know, liver pathologies. All of those types of things are good for ultrasound. Will diagnose all of those things. So, you know, we want our students to talk to their patients, have a good conversation. We tell them take good care of them. It's very important in this field that our facial expressions do not show, because we are not allowed to diagnose patients. So, you know, we work a lot on, okay, you're doing well, but you gotta watch your face. You gotta watch your facial expressions, you know, because patients can read that, and you need to make sure that you control that. Most of our graduates are at our clinical affiliates. They were employed straight from clinical. They all talk, you know, about how appreciative they are that they were able to go through this program. They found a job that they're passionate about and like to go to every day. Students that wants to take care of other people, that wants that rewarding career of knowing that they've changed someone's life potentially. Students that are really science-driven students are going to be students that are probably going to be successful in this program.
I think that sonography was really, really interesting to learn about. So I'm glad that you guys got to see that. Our next program you might be a little bit more familiar with, and that is nursing. Our nursing students get a top-notch education here at ECTC, and our program is highly respected in the state and among medical professionals because they know that our students are getting an above-average amount of hands-on experience. And in this video, you're going to see that our nurses have really big hearts and they love what they do. I'll see you on the other side.
A lot of people think nursing is just taking care of patients and doing what the doctor tells you to, but nursing is truly a job of compassion and caring. You have to be competent in your knowledge, you have to be competent in your care. You do fill out your doctor's orders, you do what you are told, you do perform skills, but there is a part of a nurse that you have to have compassion for your patients. Our nursing program, you learn the foundation of those skills. You learn the knowledge of what to look for, how to provide the management of the team, because you won't just have one patient. We have a wonderful partnership with our area hospitals, and our clinical experiences are great. You get hands-on experience. In an associate's degree program, we teach you in the lab, we show you in the lab, you practice in the lab, then you go and you do it. You actually get to put your hands on patients and be confident in these skills. In first semester, they start clinical. Right now, they go to Encompass and they do clinical on a med-surg floor there. In second semester, they start to travel to Flagey, Twin Lakes, and then Baptist Health Hardin. And then they do psych clinical at Lincoln Trail Behavioral Health. Then third semester, you go to med-surg clinical and labor and delivery, NICU, and postpartum. Then fourth semester, you are in a solo practicum with a nurse. You are one-to-one with a nurse, and it is not an instructor-led clinical. You have an instructor that will review your paperwork, and they work with your nurse to see how you are successful. That is the best part about our program, is we get to give you a real nursing experience. Well, we have 3 dedicated nursing labs that are just our low fidelity mannequins, and then we have a simulation lab with 3 high fidelity simulators, and the high fidelity simulators are phenomenal. They can do all of the things. They will talk to you. They are hooked to monitors. You can watch their entire status change. We can make them do anything at all. You become family with your classmates. You are with them for lecture, you are with them for lab, you are with them for clinical. You will see that when you form those relationships, you build each other up and you work together, you will be successful. And that also shows how you'll work in a team environment in your career, and it all starts day 1 of the program. So when it comes to you graduating and you're out there on your own, you can look back and say, they prepared me as much as they could to provide the skills, provide the competent knowledge base, and to provide compassionate care to everyone that I see and everyone that I'm a part of their life.
Super cool, huh? I told you. So just as a reminder, if you're joining us a bit late, be sure to put any questions that you have or comment where you're watching from in those comments, and just let us know maybe what you're learning or what programs that you're super excited to be learning about today. Radiography is our next spotlight, and I've got to tell you, I was pretty shocked at what all goes into the education of a radiography technologist. They're learning anatomy, all the bones in the body, how they connect, and also how to capture very specific images of different bones and sometimes several different angles of that same thing. So there's a lot of precision that goes into getting a great image, and our students are absolutely rocking it. So if you are interested in the skeletal system and you want a job in the healthcare field that's going to give you something different every day, pay close attention here.
Radiography program, we teach the student how to take the x-rays that the radiologist, who is the doctor that reads the x-rays, so we give him the images. A lot of people think we just push buttons and tell people to hold their breath, but there is radiation safety so that we're not overexposing our patients. It's being able to recognize and know your anatomy well enough that that radiologist can look at those images and figure out what's going on with the patient. What's unique with our program here is our students go to clinic at the hospitals. So they do their didactic and theory here, then they go out and they start in their first semester going to the clinic and practicing on patients. They have direct supervision until they have proven competency. They also go to different sites while they are in the program over the 2 years. So they see anything from an imaging center to large hospitals to the medium size. So they get a lot of variety.
I think radiography itself is a great allied health program that is a building foundation for a student that may not see themselves exactly knowing what they want to go into at this very moment, but they want to be in allied health and they want to make a difference. I think this is a great avenue to get that foundation of radiography, and then later on they could go back for secondary education to do CT, MRI, nuclear medicine, radiation therapy. So there's a lot of opportunities for students as they age and progress into the allied health field. Our students, because we do have cohorts of students and we're together all 2 years, I really think it's more of a family-based type of program. Students make lifelong friends here, and that is something that is extremely important and very valuable for anyone looking at a radiography program, in my opinion. So not only are they getting to see different types of patients and a multitude of patients on a day-to-day basis, they are moving about in the hospital in different settings, whether that be trauma settings, the OR, patient rooms, critical care units. So that is something that makes this modality very, very special for students. If you don't like to do that day in and day out, same job, this is a great avenue for you to get to explore those types of things.
We really enjoyed sitting down with our radiography students in their labs, and I'm sure that now you can see why. Our next highlight is of our hospital's first responders. Those are the respiratory care students. These students are dedicated to your breathing and making sure that your airways are open, making it possible for other physicians and medical staff to give you care. And something that I want to mention before we watch this video is that when we sat down with these students and instructors, there was kind of almost a sense of urgency in the room. I mean, we're currently experiencing a respiratory pandemic. We didn't foresee that this was going to be happening, but our respiratory care graduates are out there in the workforce. They're on the front lines fighting for people to be able to breathe, and I'm so excited that we get to share this program with you so that you can see all of the things that go into it that make it phenomenal at a time that it may be more important than ever. So go ahead and take a look.
Respiratory therapists are the people that respond as first responders in the hospital. If somebody stops breathing or their heart stops, then you want a respiratory therapist at your side. It could mean that we're going to be doing CPR. It could mean that we're going to set up a ventilator. It could mean that we're going to draw blood from the artery. but we're doing all of that work to make sure that that person gets breathing again. We're the people that, again, you don't know you need until it's very critical that we're there. So our program, we're very proud of 100% pass rates for the CRT, which is the first level of test that you would take after you get your degree. And so the first level is CRT, and so you're a certified respiratory therapist, and we have 100% pass rates on that. And then once you get that level, then you can take your RRT. It's not critical in the state of Kentucky that you take that exam, but we very, very much encourage that. We train you to be a RRT. You do get more money for being RRT, so everybody wants more money. If I can make more money, I want to make more money. Our equipment in the lab, we're very proud that we have the ventilators that are actually being used in the local facilities. And there are lots of ventilators that are out there in the market, and some of them are not ventilators that are used here locally, but we have the ones that Hardin Memorial uses, that Taylor Regional uses, that Norton Children's uses. We get the ones that will be the same ones that you would go to when you're doing clinicals. So once you're admitted, you're with the same group of students for the whole time. So we admit biannually. 15 students will be chosen to go into a cohort, and you're with those students the whole time. So they become your family. You work with them. We eat a lot together. They become close friends as well as, again, family. If you want to be one of those 15, you really have to set yourself up with a high GPA, a high ACT score, and then getting those general eds, the math, the English, the oral communications. The better you make yourself look on paper, the better your chances are of being in our program. I keep up with all of my students, mostly through Facebook, and especially right now during this pandemic, what I hear from them is that every day's a blessing, and they're very proud to be a part of that blessing, to be able to help somebody breathe better.
Okay, so you've seen all of our selective admission allied health programs, but I want to make sure that before we go today that we talk about our allied health programs that are not selective admission, and these are our medical information technology and health science technology programs. And these programs are great for students who want to be part of the healthcare field in administrative or supporting or entry-level roles. The Medical Information Technology Program prepares students to be medical coders, transcriptionists, scribes, medical administrative assistants, office managers, medical interpreters, and electronic record specialists. So there's a lot of things you can do with that. A little bit different is our Health Science Technology degree, which is designed for those students who are interested in pursuing education on the clinical side of allied health. This program prepares students for entry-level careers in healthcare facilities such as substance abuse recovery, aging services, medical coding, transcription, electronic health records, and medical scribes. So there's a little bit of overlap, but they are different. All the information for the Medical Information Technology and Health Science Technology programs can be found on their respective program pages. And again, you can find these on the ECTC website, navigating over to the Education and Training tab, and then to the program of interest that you want to look at. Also, again, Emmy has linked all of those program pages in the description of this video, so be sure to check those out. It's also worth mentioning that both of these programs' classes are located all online currently. Also part of the healthcare field, we offer courses in nurse aid and degrees in emergency medical services, a little tongue-tied there, emergency medical services and fire and rescue technology. Nurse aid is a certificate that can be earned as part of the prerequisite for the nursing program, and many of our nurse aid students actually take their certificate, they go to work with it, and they work as a nurse aid while they're completing another allied health degree, usually nursing, but they do work with that nurse aid while they're in school. And then also our EMS and fire rescue programs train students to be first responders. We're so thankful for them. Many of our students are actually already in their communities providing fire, rescue, and EMS services, and they're just wanting to obtain a full associate's degree for advancement or additional training, or to get some more certificates under their belt. So for all the information on all of these programs, you can find them on our website, or again in the description of this video in the program page links. If you have any questions, you can go ahead and put those in the comments again, or you can reach out to us and we'll talk about that here in a little bit. But if you've seen anything today that you are interested in, or something that's piqued your interest, and you agree that ECTC might be the best fit for you, there's a few things that I want you to put on your to-do list. So the first is our application, which is free. You can find our application online. We are an open access institution, which means we don't require a minimum GPA or ACT score to be accepted to the college. And then you'll go on to apply for financial aid. This is filling out your FAFSA. And then you'll also send us your transcripts for any high school or college credit that you have, and you'll also send in any of your test scores in that step as well. And after you do all of that, you will be what we considered ready to enroll. And when you're ready to enroll, you will sit down with an advisor virtually or in person to talk about classes, and you'll go ahead and schedule those classes and build a schedule that really works for you. If you're still contemplating and kind of taking into consideration some other factors about college, let me tell you a few things. So ECTC might be a good fit for you because we have smaller classes. We have some more individualized attention between students and faculty and staff, whether that's advisors or instructors. We're also probably close to home where you are. If you are located regionally, we have 5 different campuses, so it's likely that we have a campus near you. We're also more affordable than just about anywhere else around, and that not only has to do with tuition costs, but also opportunities for scholarships like the Work Ready Kentucky Scholarship. I couldn't go through all of this stuff with you all without mentioning the Work Ready Kentucky Scholarship. It is funded through the state legislature and was designed for students that are pursuing degrees in high-wage, high-demand sectors, but they don't have enough money for college to pay for that out of their pocket, or FAFSA and scholarships aren't covering that full amount of tuition. So you'll apply for the Work Ready Kentucky Scholarship, and once accepted for that scholarship, it will come in and pay that difference of your tuition so that your tuition balance is 0. Be sure to take advantage of that. We love Work Ready Kentucky, and we have a lot of students that are going to school for free and graduating debt-free. Now, I've talked a lot to you, and you're probably tired of listening to me, but I also want to make sure before we leave today that you get to hear directly from our students. So go ahead and enjoy this video from them.
When you take an x-ray, you're not just someone who's taking pictures. There's a lot to do with dealing with the patient's anatomy, thought process, and dealing with just the hospital procedures in general. When you go in, you got to know anatomy. You're not just looking at someone's body and taking a picture of their arm or taking a picture of their hand when they break it. There's a lot you do assisting the actual radiologist. You're kind of his right-hand man, and however well you perform is going to determine how well the patient's outcome is. I took a break, found myself, figured out what I wanted to do, and ECTC is helpful if you're a high school graduate or if you're 40 years old looking to find a new career. Once I decided what I wanted to do, they didn't talk about my past, classes I dropped, classes I didn't finish. They were just solely focused on what I wanted to do in my future. I actually have the Work Ready Scholarship. So the Work Ready Scholarship pays for all my tuition. I do pay for my books, but a small fee of $300 to $400 for books compared to $2,500, $2,800 with tuition saves you a lot of money in the long run. And actually the whole program, I have not had to take out a single loan.
I love the variety of sonography. I think going into it, I was open to the idea of abdominal or OBGYN or vascular sonography, but being in a hospital right now at my clinical that's mostly abdominal sonography, just the variety alone of everybody's got a different issue, but everybody's anatomy is so different on the inside. It's really challenging, but it's really cool to be able to see all the things we can look at and how we can help that person. Honestly, for the first clinical, I was intimidated. You know, you're kind of thrown in, a little trial by fire. You know, you get into that job setting and you can't really tell based off scanning your classmates in the first 2 months of class whether I'm going to be able to do this. But I love clinical. My last site was great. The one I'm at now, it's hard, but I am finding that I really like it, and always learning so much, always learning. Come be part of this program for Aaron Burns and Lydia Wenzel alone, because they are wonderful and they have changed my college experience. They just love us and they want the best for us, and they are always checking on us, always asking, you know, if you need to talk to anybody, come to me. And that's just something you're not going to find anywhere else. That has been the biggest part of my education here.
Basically, I've always wanted to help people, and one of my friends had some health problems, so I got to kind of work with respiratory therapist and physical therapist and occupational therapist, and respiratory just kind of jumped out at me, and that's why I chose respiratory. I would like to eventually be a travel RT, so maybe travel around the country. You need a little bit of experience, so I'll try to get into a hospital locally and work for about a year or so, and then hopefully travel. I went to UK before, and you know, it's 300 students in a class. You don't really get to know any of the students. So with a smaller group of people like here at ECTC, it's a whole lot better. You get to know everybody. You can help each other out and things like that. I'd say, for one, I'd say it's okay if you don't know exactly what you want to do. I'm older, you know, I've been out of high school for 9 years. I'm just now finding out what I want to do. Respiratory is a great program. You get to do a lot of different things. So maybe give that a consideration. Yeah.
I picked the nursing program because when I first went to college, I went to Western and I studied chemistry, but I worked at the hospital and I saw how nurses worked, and I was a phlebotomist, and I was like, that's really cool. I want to do that. So that's why I transferred to ECTC. Clinicals is fun, but it is stressful, of course, but you learn all the skills in class and you don't know how you're going to use them, but when you're in clinicals, you apply them, and it makes a lot more sense when you do it, and it's a lot of fun. My advice would be to take a career quiz. That's what I did. Job shadowing is really fun. I wanted to be an orthodontist, so I shadowed there, and I was like, I can't do teeth. But just job shadowing, and you know, when you think of nursing, don't just think of med-surg, like giving medicine, whatever. There's so many different opportunities. You can do doctor's offices. You can work in a hospital, of course. You can be a travel nurse and go to California and make big bank. There's so many opportunities you can do with nursing.
I hope you guys enjoyed hearing from our students as much as I enjoyed listening to them when we got to sit down with them. Big shout out, by the way, to some students from Bardstown High School who are joining us live. We are so excited that you guys are joining us and that you've gotten to watch some of this information about all of our allied health programs. Also, a big shout out to our students, our instructors, our staff, and anybody who is involved in the Allied Health Showcase to make it a success. We've had a blast doing this, producing this, and bringing it to you. Thanks for joining us today. If you guys have any questions, comments, or concerns, anything like that, please don't hesitate to reach out to us. You can reach out to me directly, or you can reach out to our recruitment office at ectcrecruitment@kctcs.edu. Emmy also went ahead and put that in the description for you as well because she's amazing. So thank you so much for joining us. That's it for me and Emmy here. We hope to see you guys soon. Take care.